Linda Wilkerson. I'm the Director of Pastoral Care for Parkland Health and Hospital System. It's been my privilege for the last 16 years to serve in this capacity with a wonderful group of chaplains who do so much ministry in our Level 1 trauma hospital. We have 864 beds with lots of specialties, including the only civilian burn unit between Oklahoma City and San Antonio, Texas. So we are often receiving patients and families who are often having the worst day of their life and sometimes the worst week of their life. Our chaplains have worked very, very hard to develop a collaboration with all of the members of our healthcare team, our nurses, our physicians, our child life specialists, and many of our other team members, in order to deliver the best possible care to patients and their families, particularly when they're having to deliver bad news. In the next few moments, you're going to see two examples of how our chaplains work together with our team members so that we can provide the most excellent care possible for families in the midst of their most difficult moments.
Good morning, ladies. How are y'all this morning?
Good.
Good. I wanted to see if you guys had a minute to meet. I know Mr. Roberts that came in 626. We wanted to sit down and talk with his wife about the MRI results and, kind of the plan of care. He's here this morning, but I thought maybe we could sit down and debrief before we meet with her. Do you guys have a minute?
That's perfect. Thank you for setting it up.
Good idea.
The huddle is a perfect idea.
Okay, let's go. We can use this room here.
Perfect.
Okay. Thanks for meeting, you guys. I think it's just really good that we sit down and talk about this so we're all on the same page about what we're going to talk with her. I know she's here. I think she knows what's going on, but I don't know if she knows how bad things are. It's been a little traumatic for her because when she went to bed, they both went to sleep. He was fine. And then she woke up and he was unresponsive. So they called an ambulance because I think she got really nervous. They put the breathing tube in. And I don't know if that's something they had discussed before with his big history of cancer, and that kind of thing. So what do we need to know about the patient and stuff just so we know what we're going to discuss?
Okay, medically, he's been here a full 24 hours, a little bit more, 40 years old, diagnosed with brain cancer, devastating glioblastoma multiforme about a year ago. He's had a biopsy, he's had chemotherapy, he's had radiation therapy, he's on Decadron, there's nothing else to offer. I hoped this would be reversible like a seizure or something, but it turns out this is a massive hemorrhage into the tumor, and he's in a coma and he will never wake up. And I'm not quite sure how much his wife Tina knows, but this is the day they feared.
Well, per our hospital's protocol, I did call our local agency, and they said due to him having chemo and the cancer that he's not a candidate for any kind of organ donation, so we don't have to worry about bringing that up.
Yeah, and I as large as this hemorrhage is, I don't think it's going to result in brain death, so we're going to have to go in the direction of withdrawal.
Okay. Yeah. I know they have a 10-year-old and a 15-year-old. I think they know he's in the hospital, but I don't know if they know how bad he is.
Yeah.
We do have child life support here at the hospital, so we could, see if we could meet with them and, help talk to the kids about things so they would understand. But they haven't been up here to the hospital quite yet.
I was here when Mr. Roberts came into ER with Tina. They're a fairly religious family, so I think that will be a meaningful part of the withdrawal. I think we covered everything well. I just want to make sure that we, give the appropriate time to make it a meaningful goodbye for them.
Okay, well, I think we've summed everything up pretty nicely. We've got, our plan on the medical side and on the chaplain and spiritual side. So I'm going to just go update the bedside nurse, and then I'll let you guys know when she gets here and we know what time. Tina, thanks for meeting with us in here. I know this has been an emotional week for you guys. I know you remember Chaplain Stacy and Dr. Hall.
Hi.
So we're going to sit down and just make sure that we're answering all your questions and see how we can best support you.
Okay.
Dr. Hall, do you want to start with?
Tina, thank you so much for meeting with us. I know we met very briefly yesterday morning when you came in, and we didn't have a lot of information. I know you and your husband have been going through this brain cancer for about a year. Can you bring me up to speed on where you've been and how much you understand about where we are now?
I mean, both John and I know that this cancer is terminal, that is lethal, basically. I know that yesterday when he didn't wake up, that this could be the end. I just didn't think it was this soon. I mean, we know that we even talked about having like a do not resuscitate order at one point. But we just didn't get to paperwork or anything like that.
Don't worry about the DNR paperwork. If it's time for the DNR, all you have to do is let me know that was yours and John's decision, and we'll make it so. This is a difficult conversation. The day you and John feared would come is here. We've gotten the results of the MRI, and I'm so sorry to tell you that what it shows is not reversible. The tumor has had a massive hemorrhage, and it's what's causing his coma. There is no treatment for it, and I'm so sorry to say he'll never wake up from this.
I don't know, I'm worried about my kids and what they're gonna, how they're gonna find out about this. I just don't know how we're gonna play this out. I mean, this is so much information. It's just so new and.
Tina, I understand the decision you and John have made, that we will plan to discontinue the artificial support at the time that's right. I do understand that there's some planning with family and with the kids, and fortunately Karen and Stacy can help you prepare, and I'm ready with my team whenever the time is right for all of you.
I mean, it'd be just my kids getting them information and, finding out how we can help them understand.
Okay, I think we understand everything that our plan is. You're going to let us know when your family is going to get together. Give us a call when you get here with the kids, and what we'll do is we can go in and take pictures of the ventilator, the monitors, everything that's in the room, so that way we can answer all their questions, of your husband, and make sure they understand. I'll have the chaplain here, Dr. Hall will be here, and then when you're ready, we'll go in and we can, take the tube out and make your husband be more comfortable. Well, that was a tough meeting with her, but I think that it went pretty smooth considering everything overall. I guess just to sum up what our plans are going to be, we'll just wait for her to let us know when she's ready. We'll make sure we're covering the spiritual side of things. Anything else you think that we missed or need to discuss?
Her time frame was good, 36 hours, 24 hours this afternoon, whatever she's ready. My team is ready to come support the withdrawal of the artificial support. Just call us, let us know.
Okay, well, I think we've summed everything up pretty nicely. We've got, our plan on the medical side and on the chaplain and spiritual side. So I'm going to just go update the bedside nurse, and then I'll let you guys know when she gets here and we know a time. Okay. Good morning, guys. Thanks for meeting. I know that, did you already go through the debriefing about our patient from last night?
Yeah, we had a This is awful.
Mm-hmm.
This is really devastating.
I heard about it, yeah.
The parents went out to dinner.
Mm-hmm.
They were T-boned. The husband died immediately.
Mm-hmm.
The two kids were home with the aunt.
There's kids
and
involved.
8 and 10.
Oh gosh,
That's horrible.
And which is why it's
Right.
the reason you're here.
Yeah.
And I mean, it's just horrible.
Yeah, I know the patient, it's Miss Perez. She's doing okay. She does have a breathing tube in. They put that in at the scene. But from what I understand, I talked to the bedside nurse this morning just to get an update. I think her head was clear when they did a CT scan, but her big injury, she has a broken pelvis and a broken leg, so she's going to have to learn to walk again. So she has a long recovery. The good news is they're trying to work on getting the breathing tube out this afternoon. So if they do, the reason I called you guys, I think we need to have a plan, because she's already starting to kind of motion to ask questions and around the tube. So I think she's starting to wonder, where's my family, what happened? So I think we need to try to meet and have a plan to talk about that.
Good idea.
Sure.
Okay. And sometimes things get mixed up. Are we sure that it was the husband and that he's died for sure?
Yeah, I talked to the police department. You know, he had his driver's license, so that, you know, they had that identity. Additionally, he's already at the medical examiners, and they have confirmed his identity.
And so what you were talking about was from the nurse who's
Yeah.
working with her?
Mhm. Yeah, and the patient's sister is who is keeping the kids when they were out on their date. So the kids are there. I don't know if they know anything about what happened.
Okay.
From what I briefly, her name is Lolita, the sister. I met with her briefly this morning, and she just said they're just kind of don't know where mom and dad is, why didn't they
Okay.
come home, kind of thing. So I don't think they really know anything. So I think what I can do, if you guys are open this morning, I'll call Lolita and see if she can come back. We can set up a meeting and talk to her. That way we can kind of set up a plan on what she thinks we need to, how we need to do it.
That's perfect.
I'll call the doctors and just make sure they know that we're working on a plan to tell her, and make sure that she's medically stable enough to hear the information if we feel like she's ready.
Okay. Sounds
All
good.
right, well, I'll give you guys a call this afternoon after I speak with her, and hopefully we can do it sooner than later, because I definitely want to do it before she gets the breathing tube out.
Okay.
Okay, see you in a bit, thanks.
Thank you.
Hey, Lolita, thank you so much for joining us. I know this has been a really difficult time for your family. I'm going to go around and let everyone introduce themselves, but we're all here just to support you, okay? And you are related to Miss Perez. You're her sister, is that correct?
Yes,
Just so
yes,
everybody knows.
yes.
Okay.
Tina, I'm Chaplain Stacy. I am so sorry. This is just so devastating.
Hi, I'm Dr. George. I'm the psychologist for the trauma department.
And I know we met earlier, but just so you know, I'm Karen. I'm one of the charge nurses, and also I'm one of the family support nurses, and that's what I'm doing today with you.
Hi, I'm Ashley. I'm the child life specialist, so I work with the patients that have children.
Yeah. And so our main purpose today is in meeting. I know that you know your sister's doing a little bit better. They're talking about possibly taking out her breathing tube today.
Okay.
So I know that she's been, you know, the nurse is not able to be here because she's actually in there taking care of her. But I got a little update from her this morning, and she said that she's starting to like make hand motions, and she's trying to talk around the tube. So we're not sure, but she may be wondering where, you know, her husband is, or we don't know what she remembered. So I think if they're able to get the breathing tube out this afternoon, we need to have a plan kind of set up to let her know, you know, and you being the family member, it's a really good idea for us to know how you think she would best receive that information, and we want to be able to give her some support. We definitely will have it cleared by the doctors to make sure that she's able to receive that information, but we just want to meet with you to get a plan to talk to her.
This is really hard. I mean, I don't know what I'm going to do. How am I going to tell my sister that her husband's gone, you know? They've been married for 10 years, and, you know, her best friend, they were just going to go get dinner. That's it. He's gone.
Yeah, it's really hard to make sense of something like this after it happens. The good news, like Karen said, is that your sister is doing better physically and medically, so that is good news. We don't know what she knows about what happened, and so that's, like Karen said, the main reason for us meeting is to help her with the emotional side of things, because as she gets better physically, then the emotional stuff starts to kick in. But I understand you being worried about her finding out. We don't really know what she knows.
This is going to be so hard. I mean, I know it's just going to be awful. I hope she doesn't give up. And is there a way to tell her? I mean, how are you going to tell the kids? I mean, they love their dad so much, and it's just really hard.
So previously, when we've had patients that have children are involved, Ashley and I have worked together a lot with this. She has an iPad. Do you want to tell her what we
Yes,
usually do?
I can use the iPad and we show them pictures. So we take pictures of everything that's in the room, the breathing machine, the IV, so that when they go back, they understand what everything is. It makes it a little bit less scary. So we would be able to meet and talk with the kids and help explain everything to them.
So once we figure out a time that you want to come up, you know, I'll meet you up front, and we can Ashley and I'll take the pictures after this meeting, and we can just meet in this same room, and then we'll show them the pictures, and, you know, we can kind of let them know the plan too, because it's a little overwhelming for them too, but that way she's perfect
Right.
person to help with
And
that.
I can provide resources as well.
Oh, great.
Different journals and papers and things that the kids can use to write and draw out their feelings. And then meet with the counselors. The school counselor is a great place to start, so I can help with all those resources for you.
Okay, that sounds like a good idea. I mean,
Your sister's going to need some support. The rule of thumb normally in telling people about a death is to wait until they ask. So like Karen said, they're going to take the tube out. We're going to make sure her brain is working okay and that she is able to think and remember things. And when she asks, we're going to be prepared to tell her the truth. I know there's a desire to delay it because it's going to be so hard.
Yeah.
But we want to prevent lying to her or having a different story because that could cause problems with trusting us, trusting the family.
I see.
And this was a pretty big wreck. It's in the news. So as soon as she's awake and able, she might be able to find out from another way. And normally it's better if we can control the information and let her know in the most gentle way possible.
So one of the things that I would like to, talk about is, what does she find supportive? Do you have a faith tradition
So
or a church that she's involved in or something?
Joe and her were really involved in their church. I mean, I know it would probably be, one of the pastors to come would probably be a good idea.
Oh, absolutely, I can make that happen. I can call the church.
Okay, thank
Was
you.
there a special pastor she liked that was there?
Not that I'm aware of. I mean, I think just anybody from her
Okay.
faith group, or
Sure.
from one of the pastors would be fine.
Well, we can give you a little privacy. I can take over. We have a little room over there if you want to sit quietly for just a little bit. And when you're ready, just let me know, and I'll go double check it at the bedside and make sure it's okay for you to go in there.
Okay.
Thanks, everybody, for meeting. That was awful, wasn't it?
Yeah, it's hard to
Gosh.
do.
Really
Hard.
devastating.
I know. She's got a long road ahead of them. That family's been through a lot. I guess just in summary, she's over there having her time by herself. So once we're finished here, I'll go check on her and see if she's ready to go back to see her sister. We'll kind of nail down a time and see if we can all meet. We can go take the pictures of the kids,
Sounds good.
for the
Yeah.
kids and stuff like
Okay.
that. So,
Perfect.
yeah.
Have you noticed anything else with the family as far as any other stuff going on?
No, I mean, they really seem to be pretty, grieving appropriately, normal. No, nothing that's really stuck out. So, I mean, they seem to have some good support. There's a lot of family locally, so they've, helping each other out. So,
Yeah, she seems on board with the plan.
yeah, I think so too. What about you, Chaplain Stacy? Anything?
Yeah, I'm going to call the church and get the pastor here because obviously that's very important to them.
Yeah, I think that's a good idea because it seemed like, religion and spirituality was very important in their family. So that'll be good. At least it'll be something comfortable, somebody that they know.
Sure.
So, yeah, thanks for doing that. And if I can help, let me know.
Okay.
Okay.
So you'll let us know when she gets the tube out and
Yeah.
what to do? Okay.
Sure will. Okay. All right. Well, thanks, everybody. Appreciate it. And we'll see you this afternoon, okay?
Okay.
Okay.